Good afternoon, everyone, and welcome to this week's Real Talk Live. This afternoon's live is going to be about teen pregnancy and prevention. I'm going to put some information down in the comments for how to reach HIV and STI testing at Whitman-Walker Health. But again, thank you so much for tuning in or for watching this video later if you're watching the recording. And again, my name is Ayele Ba. My pronouns are she, her, hers, and I'm the Community Health Education and Training Coordinator for Whitman-Walker Health. This afternoon's live, again, is on teen pregnancy and prevention here in the district. During the COVID-19 pandemic, the Whitman-Walker Community Health Team has decided to expand its outreach efforts to the social media platform. So welcome. We cover various topics about HIV, STI, sexual health practices, access to care, social determinants of health, and public health interventions. The Community Health Team is here to educate and support you. So again, today we're going to go in a bit about teen pregnancy in the district. So the teen birth rate has actually been declining in the district for the ages of 15 to 19. We also see different disparities among different races with the teen pregnancy rates, even when factored for different years. So in different years, they're often higher in the Hispanic, Black, and Native American communities. And we will talk about why we see some of these differences as well. So oftentimes it's discussed about these different differences and different things we can do to close these gaps to make sure that we're reaching teens and reaching children and meeting them where they are and getting them the information they need, such as lives like this, to equip themselves to prevent teen pregnancy if they're looking for it. And why are we talking about this? Why is it important to discuss teen pregnancy and prevention? Is because pregnancy and birth are contributors to high school dropout rates. So about 50% of those who only about 50% of those who experience a pregnancy or birth will receive a diploma by age 22. So that is not a large percentage of these parents. But also, you see down the line the effects of this. So children of teen mothers are more likely to have lower school achievement, to drop out of high school, to have various types of health problems, to be incarcerated during adolescence, to give birth as a teenager themselves as well, and to face unemployment as a young adult. So when talking about this, it's important to explain how this happens. A lot of teens don't realize exactly all of the ways that it's possible to get pregnant. So making sure that there are spaces where teens can ask questions and get that information in school, with parents, with trusted adults, to have these discussions about what actions lead to pregnancy, and also what ways you can protect yourself. And on the topic of the ways to protect yourself, there are various types of birth control options that are available to teens, whether at your primary care doctor or at various clinics around the city as well, if you are looking for them. And birth control is an effective method to prevent pregnancy, even without the use of a condom, which helps to prevent STIs as well. And there are many forms of birth control that you can choose from at low or no cost to you. Oftentimes you can receive it's covered by insurance, but even without insurance, you can get, there are many resources in the district that offer free or low cost birth control. So in the district, you can receive them without your parent consent as well. Some things to consider on a birth control method are, does it need to be hidden or discreet to hide from partners or your parents? Does it require you to go to the doctors or follow-up visits? Will it be charged to your insurance or you can get it for free? What are some of the side effects and benefits? And how much effort does it take to use each method? One of the most common methods that is used is the birth control pill. Most of them contain two hormones that are present in the body, progestin and estrogen. Some of them, called the mini pill, only contain progestin, and those are often used when someone cannot take estrogen. These pills are 91% effective, taken every day at the same time, and you do need a prescription from a healthcare provider to receive the pill. Some side effects that are common with the pill are bleeding between periods, sore breasts, nausea, changes in sex drive, But some benefits of the pill are that it's easy to use, allows control over your periods, and can help to reduce cramps and acne. Another type of birth control is the patch. It's almost like a big Band-Aid. It contains the same 2 hormones as the pill. It is about 93% effective, and you change the patch 1 time per week. It's placed on the skin, either of the belly, upper arm, buttocks, or shoulder blade. And you also need a prescription from a healthcare provider for the patch. And side effects include skin irritation, bleeding between periods, sore breasts, nausea, and changes in sex drive. Some benefits, similarly to the pill, are that it's easy to use. It may give shorter or lighter periods. It can reduce cramps and acne. Another type of birth control method that's available is the ring, or the NuvaRing, which is the brand name. Most contain 2 hormones that are naturally present in the body, the same ones we discussed from the pill. It is about 93% effective, similarly to the patch, and is placed on the inside of the vagina by the user. The ring stays in place for 3 weeks at one time before switching to a new one. For this one as well, you need a prescription from a provider, and it causes side effects commonly, such as bleeding between periods, sore breasts, nausea, changes in sex drive, and increased vaginal discharge. Some benefits to the ring is that it's easy to use, other than the insertion, but it may cause lighter or shorter periods and can reduce cramps and acne. Another type of birth control is the shot. The shot's brand name is Depo-Provera, and it contains the hormone progestin, one of the hormones that was in the other methods that had both of the pills, both of the hormones, like the pill, the patch, and the ring. It is about 96% effective, and it's a shot that's every 3 months at the doctor's office by a healthcare provider, and you need a prescription from a healthcare provider to receive this shot as well. But you get the prescription and the shot from the same provider. Side effects could include irregular bleeding, especially during the first 6 to 12 months using it, and changes in appetite that often lead to weight gain using this method as well. Some benefits are that it's easy to use, no one knows that you're using it, and there's nothing to remember every day or every week or every month like the ring and patch and pill, and they also give those shorter and lighter periods. Also, while we're talking about these side effects with the methods, every single method has a different effect on everyone, so you never know how a method is going to affect you. You don't always want to take what you hear from somebody else, what had happened to them, as what's going to happen to you, because each method affects everybody differently. So now we talked about methods that are more short terms that you can change every day, week, or month, but we do have methods that are more long acting. So the first long-acting reversible contraceptive that we're going to discuss today is the Nexplanon, or the implant in the arm. They contain the hormone progestin, so again, just one of the 2 hormones, and it's 99.9% effective. So comparing to the other ones that were 91 and 93, this one is much more effective. The device can be inserted under the skin of the upper arm and can be used for up to 4 years. This is inserted in a doctor's office by a healthcare provider, and side effects tend to be irregular bleeding, especially in the first 6 to 12 months. Benefits are often fewer lighter periods, nothing to remember every day, and may improve PMS symptoms. Another type of long-acting birth control is the IUD. There are 2 types of the IUD. There's a hormonal that lasts between 3 and 6 years, depending on the brand and hormone levels, and the non-hormonal that lasts up to 12 years. The non-hormonal is made of natural, safe copper, and actually makes the uterus an unstable environment for sperm, while the hormonal IUDs contain progestin, one of the 2 hormones found in the pill, patch, and ring. Both of these are inserted into the uterus in a doctor's office by a healthcare provider, and side effects can include spotting between periods, especially during the first few months, increased period flow, especially for the copper IUD, and cramps and backaches. Some benefits of the IUD is that it's easy to use. No one knows why you're using it. It's inside, and it's nothing to remember every day like the pills. And the hormonal IUD can often help to reduce cramps and make periods lighter, or to stop them altogether. But again, side effects are different in each person. Lastly, we're going to talk about some of the most common types of birth control, which are our barrier methods. Those are the condoms. There are two types of condoms, both internal and external condoms, often referred to as the female and male condoms. So the external condoms, or the ones that are applied to the penis, they come in different shapes, sizes, colors, flavors, and textures, are about 87% effective when used properly, and doesn't require a prescription, and can be found for free at certain organizations like Whitman-Walker Health. You don't even have to come upstairs, they're right in the lobby. And latex condoms should never be used with oil-based lubricants because it can increase the risk of tearing, so water-based lubricants only. There are also non-latex condoms available for those with latex allergies, available at Whitman-Walker as well. Lastly, the internal condoms, often referred to as the female condoms or the FC2 condoms, are non-latex, so they can be used with both oil and water-based lube. They can also be inserted 4 to 6 hours before even having sex. And the internal ring is removed. It can be used also for anal sex. It may take some practice to put in properly. It's a similar process to inserting like a NuvaRing, and you can get them. But these can be easy to get through your doctor at a healthcare facility that carries them. Again, like Whitman-Walker. So today we talked a little bit about teen pregnancy in the district and ways for prevention. Please feel free to leave any questions or comments in the comment section. But thank you so much for joining us today. And before we go, I want to give you some reminders about the various pandemics that we are fighting and going through as a society. When it comes to COVID-19, RSV, and flu, if you've already gotten vaccinated, congratulations. You've taken a really important step at preventing yourself, your loved ones, and your communities from illness. Multiple variants have soared across the world, and it is totally understandable why you might want to keep wearing your mask or to keep distant. No vaccine is 100% effective, and more contagious variants are spreading. There are very few protocols in place to verify the status of folks around you, so keep on staying alert. If you have not been vaccinated and you're looking to get vaccinated, Whitman-Walker Health has COVID-19 vaccines available. Please reach out to us at 202-207-2480 to make an appointment. And if you're having trouble making an appointment, get in contact with your local health department, and that information is also available at whitman-walker.org. Please continue to follow CDC guidelines for mask wearing, quarantining, social distancing, and the like. And it's very important that you consider getting the vaccine, discuss precautionary measures with those around you, and be mindful of masks, keeping your distance, but especially when you don't know if somebody has been vaccinated or not, or if you don't know if they're sick or not, or having any symptoms. But also keep in mind that monkeypox or mpox has been circulating as well. So while numbers are declining, it's still out here. So I would recommend getting in contact with your local health department for more information on getting the vaccine. And in DC, you can pre-register for an mpox vaccine appointment at dchealth.dc.gov/page/monkeypox. We also have several walk-up locations in the district to receive the mpox vaccine. Information on all of those sites are available on the whitman-walker.org website. Remember to follow us on Instagram, Facebook, and Twitter at all of our pages at Whitman Walker, and checking the website www.whitman-walker.org for the most up-to-date information on our services. For more COVID-19 resources and general Whitman Walker services, please call us at 202-797-4439 and follow the rest of our Whitman Walker Health programs at this page, Real Talk DC, and at No Filter DC, and our main page, Whitman Walker. So thank you all so very much for joining today. Hope you're all having a beautiful, wonderful day, and take care. Stay warm.